As COVID cases continue to rise, some say the state's vaccine rollout is moving too slow. Part of the problem is most vaccinations are done through small pharmacies, but one pharmacy in the Heights is trying to give more people that shot. Our Katrin Asaf is live in the newsroom with more on the first standalone vaccine clinic and why it's taking so long to receive the dose. Katrin.
Cassandra, according to the CDC, the state received more than 124,000 doses of the vaccine, but only 39,000 of them have been given out. That's only about 31%. Kavanaugh Pharmacy is trying to up that number by opening a separate area for vaccinations. On their opening day, they were able to vaccinate more than 100 frontline healthcare workers, but the state still has a long way to go. Gallery, Dr. Doug de St. Felix is appreciating a different work of art. Something he's been looking forward to for weeks, the COVID-19 vaccine.
I've been waiting since I first heard they came in.
For many like Dr. de St. Felix, the rollout has been slow, with small pharmacies delivering the bulk of vaccinations. Kavanaugh Pharmacy is trying to make the process easier.
We wanted to be able to set up the first in the state COVID clinic to be able to have a standalone place for people to come and get vaccinated.
Volunteer healthcare workers are able to vaccinate over 100 people per day, but that may make a small impact in the nationwide backup. The White House hoped to vaccinate 20 million Americans by the end of 2020. As of today, only 4 million have received their first dose. But with an entire space dedicated to nothing but COVID shots, Pace is hoping to make an impact where he can and encouraging hesitant healthcare workers to line up.
So we have been building a list for a number of weeks of those frontline healthcare workers who are interested, and we've started reaching out to them to schedule appointment times at the clinic.
As additional pharmacies look forward to receiving their batch of doses, Arkansas is hoping to see its vaccination rate go up, so more people like Dr. de St. Felix
So happy to have that behind me.
Can get back to work knowing they're covered.
I just feel greatly relieved to be able to take care of patients with the shot under my belt, so to speak.
Right now we're in phase 1A of vaccinations, meaning frontline healthcare workers and those at long-term care facilities. Essential workers are next up in 1B. That could be coming sometime in February, depending on how this initial phase goes. Reporting in the newsroom, I'm Katrin Asaf. Back to you.